Okay, today I am with a longtime friend and Kurt Mosley. Kurt is the VP of Strategic Alliances for AMN Leadership Solutions, which is based out of Dallas. I've known Kurt for many, many years, and he is an expert in all areas of physician staffing and demand. He has literally in hundreds of articles in the last 2 years alone. He has talked to well over 90 industry groups and over 6,500 people. And so I wanted to bring Kurt on today to talk about a recent survey they did around physicians in the pandemic and some of their impacts. So with that, Kurt, thank you so much for doing this, number one. And number two, kind of give us an overview of what you learned in the survey.
Well, Hayes, thank you very much for including us in this survey, which we did in conjunction with the Physicians Foundation. And let me just briefly explain that the Physicians Foundation is a not-for-profit group of medical societies that throughout America is trying to empower our doctors to help them be better doctors, deliver better quality care, and help them navigate the healthcare system in the past, which was tricky, and now it's been turned up on its head. But we did this pulse survey for them, and their main focus also, the foundation, is to reestablish that patient-physician relationship, which everybody in America wants. The survey was very unique. It was a 3-question survey. We had over 800 respondents, and the good news about it is that the doctors that responded, 66% were specialists and 34% were primary care, which is almost right along the party line, if you will, of the AMA numbers. 33% of the doctors in America are primary care and 67% are specialists. So we feel real good about the survey, plus or minus 3% in validation. So it was a great survey. It was only open for 2 days. And like you said, it had over 800 doctors respond. So we're really, really pleased with that. You know, some of the positive of the survey, there was encouraging and concerning news of the survey. There's, plus and minus, but the positives is just how nimble our doctors were in responding to telehealth. In a survey we did with the foundation back in 2018, 18% of the doctors were using telehealth. This survey indicated over 48% of the doctors now are using telehealth. It's good for the doctors. They like it. It's good for the patient population. Our patient population has never experienced telehealth like this, and they like it. Doctors like it. Patients like it. So one of the silver linings is telehealth is going to advance. And also, it really, of the doctors, 38% of the doctors were seeing COVID patients. What I really liked, the doctors that weren't, almost 60% said they were willing to do so, which showed us there's still some capacity for these doctors to take care of these patients. But in some instances, license was preventing them and helping that. And then I think another really key thing is the survey really indicated how our doctors, our medical community as a whole, and I'm talking nursing, doctors, lab tech, everybody, and just really that they've come out and really shown their mantle, if you will, and they're really the frontline warriors in this fight for life in America. And I really, we ought to take their hats off to them, how quickly they responded and how nimbly they responded. Some of the negatives of the survey, and there were some, 34% of the doctors said they're going to change the way that they see patients. And that's a concern because that's always converts into an access issue. And when I talked about the change, 14% said they were going to leave their current practices. And, that's a big concern. 5% said they're going to retire. Now, everybody said that's only 5%, but there's 830,000 doctors, Hayes, and that's 41,500 doctors that are going to exacerbate the current shortage. And the shortage is not even debatable anymore. We've spoke on it for years, but it's going to exacerbate that shortage. And then I think 1 in 5 doctors either had to take pay cuts or they were furloughed. And I'm very fortunate here in Dallas. I have 4 neighbors that are all doctors, and 2 of them told me the story that their pay cuts and furloughs were handled correctly. 2 said they weren't, and they said they're going to seek another practice opportunity. Burnout's always been it's been in the news lately, but this also highlighted COVID. It really highlighted how burnout's affecting our doctors, and this may push some of our doctors over the edge. But the good news is majority of doctors that were taking care of COVID patients said they can continue to do it. So there was not anybody that was really going to give up. But my concern is, how do you re-engage with these doctors after everything's over? And that was the survey also showed us, how do we come back in, during times of crisis, we band together, and I think everybody's done a great job, but how do you come back to these doctors? You either had to furlough or cut their pay because you're going to need them. And My other neighbor brought over an immunologist the other day. He talked to me about the fall, and he said we may have a resurgence of this depending. And you and I have talked about this, but if we reopen too soon, do we have a fall, deja vu, if you will, about this? And then I think physician wellness, 8% of the doctors that were taking care of COVID patients said they were going to seek some sign of physician well-being or some sort of mental health, because it's just very frustrating. My one neighbor said she lost 2 patients, and her big issue was she never had this before, where the family couldn't see that patient in his last hours. And it's a real tough situation in America. And again, we all really have to band together. But another issue that we brought up is how do you get these doctors back online, and how are you going to pay them when the crisis lessens? So there's a lot of uncertainty about the future, and I think that's our doctors are not necessarily concerned about the future of healthcare, but their future of America, and that's something we all have to take into consideration. So,
well, to your point, I mean, I think we've never seen a time when doctors are being, challenged like this. And so your survey obviously kind of highlights that. And what was the retirement number again? You said it was only 5%, but what was that number again?
Well, you take 5% times 830,000 doctors, that's 41,500 doctors that they said now we're going to depart. And again, that's just highlighting, we had a shortage before this, but this is just exacerbating the shortage, which, like I said, it's not even a debate anymore. There is a shortage in America, and we've seen especially shortage. And what's unique also that we saw about COVID and our doctors taking care of it, obviously our elderly population was affected. And for the first time ever now in America, we have more people 65 and over than we do 0 to 17. So again, those were the ones that were really concerning us. So,
I mean, again, those numbers are just stark to me. So if someone wanted to know, to get access to this survey, because it might help their company and or their hospital system, where would they do that, number one? Number two is, how would they get hold of you, Kurt, to maybe for you to speak to their organization or their company? How would they do that?
Well, they can reach me in my email. It's Kurt, KURT.Mosley, MOSLEY, at amnhealthcare.com. If they'd like a copy of the survey, I'll be glad to send it to them, or any of the recent articles we've written on. So, and Hayes, if I can say, if you're visiting with doctors, be really aware that they're in the middle of a crisis in America. And, people say, what do you define as a crisis? In my lifetime, we've never had a situation where civil liberties are bumping up against public health. And I think our doctors in the middle of it, it frustrates them. They want to take care of patients. We're seeing everybody come back with these recommendations, and it's not necessarily elective surgeries, but we call them selective surgeries. These are things that people have put off. We're hearing of vaccinations being skipped, checkups, diabetes checkups, and also skipping chemotherapy treatments. So this is going to come back with a vengeance, and the doctors need to be there to take care of this, because we're going to get a surge right after this. A lot of people are putting this off.
Yeah, truly, the acuity of these cases are going up. And so, Kurt, thank you so much. Again, you're just a wealth of knowledge as it relates to any of the physician behavior, dynamics, and the demand. So I appreciate you doing this today. And let's stay in touch. And perhaps the next time you have some more information or survey, we'll get you back on. But thanks so much, Kurt. I appreciate it.
And thanks, Hayes. And just anybody on the talk today, just keep a kind thought for our service personnel here and abroad, and our frontline responders, our doctors, our nurses, and our medical community. They're the true heroes now, and they need to be recognized for it. But thanks for thinking of us, and hope everybody has a good day, and most importantly, be healthy.
Thank you so much. I appreciate it. Thanks so much, Kurt. Bye-bye.